Hello, I'm Tracy Holly. I work in higher education with nurses and social workers, and I'm a mental health survivor. And I'd like to introduce you to Max Birchwood.
Hi Tracy,
Hello.
Nice to be here.
From your perspective, what do you see as causing or contributing to mental distress?
Well, mental distress is a big, broad spectrum of difficulties that people have, but there have been in the last, 10, 15 years some better understanding of the common social influences on the development of mental distress across the whole spectrum. They're really rather interesting, from depression and anxiety problems right through to unusual experiences such as hearing voices and what's called a psychosis. One of the most influential pieces of work for me was the wonderful work of Brown and Harris in the 70s, 80s and 90s, and this was an enormously important piece of work looking at the social origins of depression. And this was a piece of work initially looking at the risk factors for depression in young women, but it has generalisation right across the piece. So what Brown and Harris found was that those individuals who'd in their very early lives had been exposed to traumas of one sort or another, from one level being involved in a car accident or at the most severe end of sexual abuse, particularly individuals who'd been subject to losses of various sort, particularly where one of the parents had died or had the family had split up, and also major social inequalities are very, very important. So, which we know are very important in health generally, but particularly important in mental health. So those individuals who have social capital, their social assets, their relative level of deprivation relative to others in society. These are the kinds of things that have proved to be very important predictors of individuals developing a range of mental disorders, mental distress later on in life. What's particularly interesting in the last couple of years, and this has been certainly the case in psychoses, is that it's now understood that social influences at an ecological level, at a kind of wider social level, are very important. So thus, individuals who live in fragmented social communities where there's low, poor relationships, people don't feel part of a stable social network, and where there's a lot of social mobility and there's not many kind of friendships or networks at a community or neighbourhood level. This seems to be very important in predisposing some individuals towards a varieties of mental distress. So, from my point of view, as someone who practices cognitive behavioural therapy, these sorts of early developmental experiences are key parts in individuals' developmental trajectories, have an impact on the way the individual sees him or herself and how the individual views the world, in particular other social relationships. So, for example, if someone has had, an abusive history, let's say, this can have two consequences. One, some individuals feel that they deserved that kind of experience and can feel subordinate to others and sometimes even seek out abusive relationships later on in life. And it can also lead individuals to feel have kind of low self-worth and feel that they're not worthy of other people's attention and love and so on. So these sorts of self-evaluations, as we call them, can persist and be present in someone right throughout their lives and have a direct influence on how they interact with others and the stress that they kind of go through later on in life. So I suppose that's the first thing that would be in my mind then, would be these developmental experiences, a crucial part of an individual's life trajectory, how that influences the individual's beliefs and thoughts about themselves and and their relationship with other people. But of course, people can also experience important life context, life circumstances change over time. People are not necessarily always a prisoner of their past, and life events can crop up, as we all know, at any point in your life. So again, the work of Brown and Harris always was a very powerful influence on my thinking. We know that if you were assessing a client at this current point in time, as well as wanting to know about this developmental history, I'd be very interested to know in the individuals whether there's a stable context for that person, there's a stable family or partner, and if not, whether that's a difficulty or problem for the individual, and how that may relate to someone experiencing depression or anxiety and so on. Employment is a very important factor. We know that people are in stable employment and stable relationships. These are very strong protective factors against all sorts of mental distress. But of course, in different kinds of work contexts, we all experience stress and difficulties. And so again, if I were assessing a client and talking to a client about their situation now, I'd be very interested in how they would be getting on at work, and whether they felt in control of events at work and had a sense of autonomy over their work context. Again, that's been shown to be very important in developing mental health problems later in life or in maintaining them. So that would be the kind of context that would be important for me in trying to make sense of someone's mental distress. What's interesting is that we talked at the beginning about this continuum of mental distress from depression, anxiety and so on, right through to unusual experiences such as hearing voices. And what excites me a great deal in the last few years is that the so-called serious mental health problems, the psychoses and manic depression and so on. When I was trained many years ago, I was taught that these sorts of disorders happen, as it were, like spontaneous combustion in different parts of a community or a city, independently of one another. They're not subject or influenced, in other words, by the social context. But what we now know is that there is a very important social context to the severe mental health problems. So, for example, people who hear voices, as a lot of my work has been focused on this over the years. We know that people who hear voices are not always distressed by those experiences. Many individuals can have imaginary friends or experiences when they're very young, at age 10 or 11 and so on. These things are very evenly distributed in the population. But for some individuals, those experiences those kind of childhood experiences can develop into distress and become in the spectrum of what's called a psychosis because of the same social influences that are brought to bear on that individual. So those individuals who've experienced childhood traumas, social inequalities, and particularly where depression can intervene in adolescence, this can set the scene for a metamorphosis of what was innocuous childhood experiences of voice-like things into an experience of auditory hallucinations where the individual is subject to criticism and adverse comment, and where the voices can be really rather derogatory and unpleasant. And these important social and personal factors can influence the development of distressing experiences such as voices. And for therapy, well, that's very, very important.